Hello YouTube and welcome to the inaugural episode of EM Spanish. I'm your host, Professor Sancho, also known as Chris Tanner, and I will be going over briefly some introductions to this podcast or video series, as well as different ways that you can introduce yourself to patients. So, brief disclaimers: the views and opinions expressed in these videos are mine and mine alone, and not to be affiliated with any residency program or medical system I may be associated with. These guides are intended as an educational resource and should not replace or discourage licensed interpreters when caring for your patients. And although we put a lot of work into these videos and podcasts, we cannot offer any warranty, be it for errors, omissions, or consequences when using them in patient care. So, a few words over my vision for this video series. Ideally, I wanted to modernize language education. I came up with this idea after becoming a fan of various podcasts for medical school as well as studying emergency medicine. And although I found different podcasts available to learn medical Spanish, I didn't find anything that was very focused in an almost immersion-like setting to teach you the phrases that you needed to know to really jump in and minimize the time that you will be spending. So ideally, the target audience for these videos is emergency providers, be it from nursing to patient care techs, as well as medical residents and attendings. And as in learning any language with the hopes of applying it in your patient care, the entire goal of it is to improve patient outcomes by improving patient satisfaction as well as the likelihood of their compliance with your treatment plans. So the way that we do this is by reducing language barriers, which can just lead to a more rapid development of a patient-provider relationship. And lastly, the entire goal of this is to really encourage play when dealing not only with your patients, but with other fluent speakers, be it family members or even coworkers that know the language better than you. So, briefly about myself, I'm currently a fourth-year medical student on the interview trail for emergency medicine residency, and my Spanish backgrounds includes taking various courses in high school as well as undergrad. Additionally, I lived for 1 year abroad in Spain in a town called Malaga and improved my fluency greatly there. And since returning back to the States, I took over a medical Spanish club while in medical school and was able to teach and develop curriculums for my peers as well as some nursing students and even residents. So I also have experience interpreting during my clinical rotations as well as various free clinics around Chicago. So my personal goals for this were to really improve and review a lot of the medical Spanish before starting residency. So a lot of this will be a work in progress for myself, and I hope to continue it once I start residency. So if you have any feedback or lessons that you'd like to see in the future, please leave a note in the comments section, shoot me an email, even if it's just to say if there's a disagreement on how to say a particular word, or if you have it said differently in your region. It would be greatly appreciated. So a couple of tips and tricks on how to get the most out of this series is to not be daunted or think that you have to learn the whole language or become a fluent speaker to really get out there and make a difference. So the analogy that I use is that if you are a waiter in a restaurant and you do not speak the language of the customers that were ordering, you would be able to learn various phrases on the menu to be able to describe to them. Even though you may not be able to function outside of that restaurant, you'd still be able to deal with that limited menu. So within emergency medicine, there are only so many chief complaints, and ideally we'll be presenting different lessons to help you focus on that. And of course, these are meant to help you, but the only way that you will get better is to practice. I encourage doing this in a safe environment with an interpreter and even on your own. So the other nice thing is that there are many shared words with English, so there are a lot of cognates, as it were. So, for example, the word asthma is asma in Spanish. And the other thing is, by just making an effort to even introduce yourself in a patient's own language, the patients will love you for making an effort rather than feel embarrassed or anything of that sort. So a lot of times it's just getting over that sense of shame and embarrassment. So, and additionally, not only will patients love you, but there are cultural reasons to do it. There are two concepts that are known in various Hispanic cultures, known as personalismo, in which they would like a more informal interaction with a provider. So, be it a quick question about their family or their own general well-being is very important to them. And additionally, if you can do this or even say a few words in their language, it will go a long way towards gaining their confianza or a patient's trust, and they'll be more likely to open up to you when presenting for a history or a physical, as well as follow your different treatment suggestions. So, most lessons will be formatted around a chief complaint. And ideally, it will start with a brief overview of relevant anatomy that you can refer to when talking to the patient, as well as a couple of useful phrases when poring over the history of present illness, and then going over any different past medical history, past medications that could be important, and then different phrases that one can use for the physical exam, as well as finishing it up with different plans, such as telling a patient that we need a sample of their urine, or for them to expect to get an X-ray. Can be important for them to know what to expect. So to begin, a couple of different phrases that you can use to introduce yourself to patients. So, my name is, me llamo. My name is, me llamo. Nice to meet you. Mucho gusto. Nice to meet you. Mucho gusto. I am a medical student. Soy estudiante de medicina. Or to say I am a nursing student. Soy estudiante de enfermería. I'm a doctor. Soy doctor. If I were a woman, I would say soy doctora, adding an A to indicate the feminine gender. To introduce oneself as a nurse, soy enfermero. Alternatively, for a woman, soy enfermera. I don't speak much Spanish. No hablo mucho español. I don't speak much Spanish. No hablo mucho español. Answer with yes, no, I don't know. Conteste solo con sí, no, o no sé. Answer only with yes, no, or I don't know. Conteste solo con sí, no, o no sé. More slowly. Más lento. More slowly. Más lento. Repeat, please. Repita, por favor. Repeat, please. Repita, por favor. Sir, señor. Madam, señora. To introduce oneself as, to ask or refer to someone as the you in the formal phrase, you would use usted. You formal. Usted. Keeping in mind that we'll cover the informal tu when going over pediatrics lesson. However, for all adult patients, you should use the you formal, as it's a sign of professionalism as well as respect. So to refer to oneself, yo. Me, yo. Him, él. Her, ella. Keeping in mind that ella is spelled with two L's, which are pronounced in Spanish similar to a Y in English. So yes, sí. No, no. Maybe, quizás. Maybe, quizás. I don't know. No sé. I don't know. No sé. And that concludes our lesson on introductions. So go out there, introduce yourself to patients and practice, as there's zero risk involved with just making an introduction. Show off that bad accent and really improve it. Additionally, for the male viewers out there, an easy icebreaker to use is to say estoy embarazado, which instead of saying that you're embarrassed about your Spanish, it actually translates to be I'm pregnant. So, estoy embarazado. Alternatively, if you're a woman, one can say estoy embarazada, but the joke is a little bit more controversial. So, again, that concludes our lesson for today. If you like this video, please subscribe, share with your friends, and we'll be putting up an episode covering abdominal pain and following it up with a 3-part series going over the history and physical. So thank you so much, and we'll see you next time on EM Spanish.